thank you. So I'm Dr. Kennedy at Rose Kennedy from Dyneley House Surgery in Skipton. So I'm just going to do a quick run through of kind of mainly focusing on cancer screening and talking about the national cancer screening programs in the UK at the moment, including cervical cancer, breast cancer, and bowel cancer. I'm going to talk about kind of some lifestyle changes that you can do to reduce your risk of cancer. And Stephanie is going to talk about what Craven Leisure have got to offer in Skipton area. So it's hopefully going to be a good kind of overview of trying to prevent cancer and picking up cancers early. So what is cancer screening? So cancer screening is a test that's looking for the early signs of cancer, and it's mostly in people without any symptoms. So we're aiming to identify these cancers at a really early stage. And that means that the treatment is more likely to be curative. Patients have a better prognosis, so management can often be started earlier and patients' journeys are often better. So the first one I'm going to talk to you about is breast cancer. Breast cancer is the most common cancer in women. 1 in 7 women in the UK will be diagnosed during their lifetime. And that's 55,000 women each year. So it's a huge impact on our society. I couldn't get any up to date. The last kind of statistics I could get was 11,500 people between the years of 2016 and 2018 died as a result of breast cancer. And Cancer Research UK have put some statistics together that show that 23% of these cases are actually preventable. And a lot of people don't realise, but there's 8% of the cases are caused due to obesity. And 8% are also due to alcohol intake. So a lot of people don't kind of associate obesity and alcohol with breast cancer, but there's simple things that are lifestyle changes that we can do to reduce our risk. So breast screening. Breast screening is available to all women, some transgender men if they're born female, and non-binary people aged between 50 and 70 are invited every 3 years. You might be eligible for more screening if you're deemed higher risk and you've been referred to the breast clinic and have been put onto kind of annual screening, or if you have kind of a strong family history of breast cancer. If you feel like you do have, a kind of high family risk, it's important that you speak to your GP and we can refer you appropriately to get that enhanced screening. If you're over the age of 70, you can continue to request screening, but you won't be routinely asked. So you need to contact the Pennine breast screening team. The mammogram is essentially an X-ray of your breasts. And as you can see from the picture, it's essentially just squashes the breast tissue and takes an X-ray of both the breasts. The people that operate the service are really kind of sensitive, and they're very kind, and they are very good at if anyone's very anxious about going for the breast screening. And it shouldn't be painful, but obviously it's a bit uncomfortable, and it only takes a matter of a few minutes. So breast screening itself, for every 1,000 people that screen, we'll pick up 9 cancers. So it's really important that you do kind of respond to the invitations if you get them in the post, and book your appointment. So this is just to show you that mammograms can find breast cancers at a really early stage, and this means that they're more treatable. We're more likely to be able to kind of treat the cancer completely, and there's less risk that it's spread to other areas. And this picture just highlights that from how small the kind of, if you're doing regular mammograms, you can pick up very small tumours as opposed to someone doing a self-examination. So what do we offer in West Yorkshire? So at the moment, the Pennine breast screening service is actually coming to Skipton at the end of June for 6 months. And they're sending out all the invitations at the moment. So it's really important that when you get that letter that you ring and you book the appointment. And as I said before, if you're over 71, you can just ring that number directly to book your appointment. And as I said, the ladies who kind of do the screening are really, really helpful. And if you've got any concerns, there's lots of information on their website. And also on YouTube, there's links to videos where you can actually watch someone having a mammogram. And it's not scary. And a lot of people are quite worried about having it initially if they haven't had one before. But it's really important that you do go. So this is a really good website that I talk to a lot of patients and refer them to. And it's a global charity called Know Your Lemons. And it's really helpful, and it just shows you all the different things to look out for when you're doing a breast examination on yourself. So it also has good videos about, and you can download an app about prompting you to do regular breast examinations, which is really important, because it's really important to know what's normal for you, and then you'll pick up on anything that's abnormal. So all these lemons just show you, so things like any lumps, any thickened area, if you're having any discharge, if the area is hot or red, any crusting, any kind of orange peel appearance on the skin, all these things you need to speak to your GP surgery and get seen. It's really important. So just moving on to cervical cancer. So cervical cancer is approximately 3,200 new cases every year. Mostly affects the younger women under the age of 45. And the Cancer Research UK statistics show that 99.8% of these are actually preventable, and they're caused by infections. So the cervical screening. So again, it's women, some trans men, and non-binary people with the cervix aged between 25 and 64 will be eligible for cervical screening. They're invited every 3 years between the ages of 25 and 49, and then every 5 years until the age of 64. The cervix is basically the opening of the womb from your vagina. So just here, you can see where I'm pointing. And it's easy to see when you put a speculum in. The sample is sent to the lab and is tested for a virus called HPV, so human papilloma virus. And if it's positive, then it's sent for further testing. The results are then sent in the post a few weeks later to the female. And then you're referred to the colposcopy if it's positive. If there's any abnormalities or if they're concerned, then you'll be referred to hospital for further testing. So what is the HPV virus, human papilloma virus? So it's a really common virus. Most people will have had it at some point if they've been sexually active. There's over 100 different types of HPV virus. Some cause genital warts, whereas others cause the cancer. There's no treatment as such, but most people will actually naturally clear the infection within 2 years of having it. And the really exciting news now is that in the last few years, we've got the HPV vaccine, and this is being offered to children, secondary age children, between the ages of 12 and 13, and those patients that are deemed at higher risk. And so hopefully we're going to see dramatic reduction in the incidence of cervical cancer in the next few years to come. And the idea of vaccinating this group of people is trying to get people before they become sexually active. This virus, HPV, is not only linked to cervical cancer, but it's also linked to mouth, anal, penile, and vaginal cancers. So it's really important, and it's really good to encourage uptake of this vaccination. So cervical cancer symptoms. So any of these symptoms. So any vaginal bleeding that's unusual for you. So that's bleeding in between your periods, bleeding after sex, or if you just notice that your periods have changed. Any changes to the vaginal discharge, any unexplained pain in your lower back or your pelvis, or any pain or discomfort during sex. Any of these symptoms, you need to be speaking to your GP. They can be due to other causes, such as endometriosis or other causes of gynae problems, but you really need to be speaking to them to make sure that you get examined and check that everything's okay. So moving on to the last bowel cancer screening. So bowel cancer is the 4th most common cancer in the UK. 42,900 people are diagnosed each year. The main risk factors are increasing age, genetics, which is obviously these two we can't do anything about, but diet and lifestyle factors play a big role in bowel cancer. Alcohol has been linked to 6% of new cases. Smoking is linked to 7% of new cases, and obesity has been linked to 11% of new cases, and that's a BMI of over 30. So the bowel cancer screening aims to find early changes in your bowel that can lead to cancer, and the test is sent out in the post, and it's called a FIT test. In England, it currently rolls out from the age of 60 to 74, but we're slowly extending it out to start at the age of 50. And I think in Wales and Scotland, they already start from the age of 50. So we're looking for tiny traces of blood that you can't necessarily see with the naked eye. And if it's positive, then you'll be informed and we will refer you to the hospital for further tests. And that normally involves a camera test into your bowel or a CT examination, depending on whether you're fit enough to have a camera test. But the things to look out for are any unexplained bleeding from your back passage, any blood mixed in with your poo. If you've had a change in your bowel habit, so if you're going more regularly or you're having looser stools or you're more constipated, if you're losing weight that you're not expecting to, you've got unintentional weight loss, or if you're feeling really tired and you're not really sure why, or you've noticed any unexplained pain in your tummy or any lump in your tummy, then it's really important that you again speak to your GP and get examined. So on the Cancer Research UK website, you can actually, if you're not sure if you're eligible for screening, you can actually put all your information in, and it will tell you exactly which screening program you should have had, and you can double check that you are kind of up to date and you have done everything that you're eligible for. So in terms of lifestyle things that we can do, so stopping smoking. So smoking is one of the biggest causes of cancer in the UK. It's linked to over 15 different cancers. And I think a lot of people always just associate smoking with lung cancer, but it affects a lot of cancers. So it's linked to 15 different types, like I said. So lung, mouth cancer, larynx, bladder, stomach, kidney, bowel, all of these are kind of can be linked to smoking. And there's no safe level of smoking. The advice is that you should stop completely. But obviously we appreciate that's hard if you've smoked for a long time. So any reduction is good. And also I think it's important to not forget about passive smokers. So, we do see lung cancers being diagnosed in partners of smokers who haven't had any cigarettes, but they've just inhaled their partner's cigarettes for the last 30 years. And also we see a lot of children, not necessarily cancers associated with smoking, but with respiratory illnesses as a result of smoking. So it's really important that we try and encourage people to stop smoking. If you want any help, locally in Skipton, we can refer you to the smoking cessation team. And online, there's a really good website called Smoke Free Online, and you can download their app to help you as well. And there's lots of kind of medication that you can go on to replace the nicotine. So in terms of other lifestyle things you can do, so having a healthy, balanced diet is really important. So this can predominantly reduce your risk of bowel cancer. So aiming to have lots of fruit and vegetables, lots of whole grain foods, brown rice, rolled oats, lots of healthy proteins, so beans and pulses, and cutting down on all those things like processed meats, red meat, alcohol, and kind of high sugary drinks and fast food. All of these will reduce your risk of things like bowel cancer. Keeping a healthy weight as well. So obesity is the second biggest cause of cancer after smoking, and not many people realise this. And obesity is actually linked to 13 different types of cancers. So bowel cancer, breast cancer, uterine cancer, pancreatic cancer, and liver cancers are the kind of main ones. And not only does it reduce your risk of cancer, but it also reduces your risk of other health conditions, so type 2 diabetes, heart disease. And in terms of kind of this picture just shows you really how kind of being overweight and obesity can cause cancers. So the fat cells increase the inflammation and they make extra hormones and growth factors. And these stimulate your cells to divide more often. And this increases the risk that a cancer cell is actually made. And then as time goes on, these cancer cells continue to divide and multiply. So physical activity, I won't go into this too much because I think Stephanie's probably going to talk about what Craven have to offer. But being active in general lowers your cancer risk significantly. And this is particularly for breast and bowel. And as I said before, it's also really positive for your mental health, your cardiovascular health, and just general health. But I won't go into too much detail with this. So the other thing you can do is cutting back on alcohol. So cutting back on alcohol reduces your risks of over 7 different types of cancers. Predominantly things like liver cancer, breast, bowel, and mouth and larynx cancers. So with alcohol, any reduction is good. The NICE and NHS recommend that you shouldn't drink any more than 14 units a week, but that's just a guideline. The less that you drink, the better. And I think I don't normally quote the Daily Mail, but this picture was a really good picture that I found that I often use with patients because it shows you all the hidden calories of alcohol. People don't realize how many calories are in kind of a glass of red wine, for example. So people are quite happy to have kind of 2 or 3 glasses of red wine with a meal, but they don't realize that's actually kind of 600-700 calories extra, and you wouldn't have 3 Mars bars in a go, So I think it's just really important if you're trying to lose weight and you're trying to live a healthier lifestyle, that you actually need to also think about your alcohol intake, because it can significantly boost up your calorie intake. So in terms of how you can reduce your alcohol intake, so we advise about having alcohol-free days, not only to rest your liver, but also just to try and reduce the amount that you're drinking on a weekly basis, trying to alternate alcohol with non-alcoholic drinks, swapping your usual drink for a small drink, save up the money that you would spend on alcohol and do something nice like an activity. And don't buy extra to have in the house, because then the temptation's it's been removed. And there's also another good website with an app that you can download to help prompt you about kind of tips about how to reduce your alcohol intake. So, and finally, in terms of lifestyle things that we can do, so enjoying the sun safely. So too much UVA radiation from the sun and sunbed will damage your skin. And this can cause skin cancers. So 9 out of 10 melanomas are thought to be linked due to sun damage. This can be easily prevented. So, avoiding the midday sun, covering up, making sure that you're seeking shade, wearing wide brimmed hats, covering your shoulders, wearing sunglasses, and also making sure that you're wearing SPF at least 30, and it's got a good protection of the stars, 4 or 5 stars for the UVA protection. And this will hopefully protect you from the UV radiation that can lead to cancers. So in summary, about 4 in 10 cancers can be prevented, and there's lots of things we can do to try and reduce your risk of cancer. And the main things, as I've discussed, are living a healthier lifestyle. So eating better, exercising more, stopping smoking, reducing your alcohol, and being sun aware. Really important to attend your cancer screening, so we're picking up these cancers early and not when they're more advanced. And as I said, and I've discussed the symptoms to look out for, if you're concerned or if you have any worrying symptoms, then please just speak to your GP. Thank you.
Thank you. That was a great talk, by the way. Some really interesting points there. So as mentioned, obviously physical activity, if it helps in the reduction of cancers, but also it's great for physical health and mental health as well. So it's a really sort of positive and healthy habit if we can try and build that into our lifestyles somewhere. I do work for North Yorkshire, but I'm based at Craven Leisure. So to give a bit of an overview of some of the services that we offer, we do obviously pay-as-you-go kind of options. I don't know if you're all familiar with Craven Leisure, but it is based in Skipton. And we have a 25-metre pool. We have a gym, a studio with lots of exercise classes, a spin studio, lots of different offerings which are available pay as you go, but also we do like memberships and other schemes as well. So within our sort of healthy lifestyle bracket within the leisure centre, we have a couple of services, couple of programmes that may be of interest. The first one is an exercise referral scheme, and this programme allows healthcare professionals, so your GPs, to refer individuals with a variety of medical conditions or a history of sedentary lifestyles who wouldn't normally participate in physical activity. and this is a 12-week program where you would be able to use the gym and the swimming pool, or one or the other, for 12 weeks, unlimited use. And there is a cost for that, but it is quite heavily reduced from the usual rate. So it is £28 a month, and that is for the obviously 3 months. So you could pay up front, which would be £84, or you could sign up for a direct debit. So it would be those three payments coming out. And your GP will have all the relevant paperwork in all the Craven surgeries, and they would directly refer you as a patient into the leisure centre, and then we would be in contact then to arrange an initial assessment, and would go through all medical and health issues, and then we'd design you a programme to fit your needs. And then you'd have regular programme reviews as well within that 12-month period. So that's a really good option if you feel that you would benefit from that kind of help and support, and your GP agrees that actually being more physically active may help manage some of your conditions, or introduce exercise, which currently you may not be doing at all. So the scheme is available to patients who are sedentary or physically inactive, and that's classed as less than 30 minutes activity per week, and it is for age 16 and above. That is a great sort of scheme that we have got going. We've had it going quite some time now, and we've got highly qualified instructors that would be able to efficiently give you a program that's well suited for any medical conditions. We do also have a weight management program. Obviously, to prevent cancers, we want to be trying to obviously reduce our body weight and take on a more healthier approach to whether it be food, exercise, alcohol, smoking, as mentioned before. So the weight management program, again, this is a 12-week structured program. And the criteria for this is you must have a BMI of 30 or above, or 25 and above. If you've got any comorbidities which are managed, then you are eligible for the program. And it is an adults weight management program, so 18s and plus. And with this particular program, it is a weekly commitment. So you would have to commit to a particular session per week. And we have these daytime, and we also have them in the evening as well. And within the weekly groups, it's then structured as nutrition. So we cover different topic each week, from portion control to eating awareness to emotional eating to drinks, alcohol, etc. And we also involve exercise within that weekly group as well, because we know that obviously it does help and aid with the weight loss, but there's far more benefits as well to physical activity. So it's a multi-component program. The sessions are 1 hour and 15 minutes each week. And again, these are small group settings with obviously like-minded people in the group, and the groups are really informal. The idea is that you're sort of coming along with an open mind, and if you take one thing away each week that you're going to swap, try, or implement, that's a positive. And actually, weight is sort of the byproduct of improving health and well-being, which is the approach that we take. So that's an initial 12-week program. We do set a 5% target loss, and that's commissioned by Public Health. And if you do achieve that 5% at the 12-week mark, then you are eligible for a further 12 weeks help and support. And this program is all free. So it is up to 24 weeks support, free of charge. And part of that program is that you are able to receive one free gym or swim pass each week as well up at Craven Leisure. We do also have a session in Settle. I'm not sure whereabouts everybody's from, but we do run a weight management session every Thursday morning up at Settle Pool. And again, we offer the free swims up there. Obviously, there is other providers elsewhere. Keighley do the Healthy Living Programme, which I believe is, offers similar kind of programs to us, like through the BEEP scheme or another kind of weight management program. But, it's great that what I will say is Craven Leisure as a whole, um, we've had people either through the GP referral scheme or the weight management scheme using the centre that wouldn't usually step foot into that kind of environment. And that's obviously really positive, and it reflects as well the kind of atmosphere that is up there. So it's, again, we're promoting exercise for all abilities, for all levels, ages. And I think that clearly shows when we're getting so many people coming through. And I think sometimes it's that barrier, that initial barrier of stepping through the door. But once you're in, it's that comfortable, safe environment. And obviously, if you're exercising, obviously you'd gradually build up as you go along. But it's a really positive, healthy habit to get into if you can involve it somewhere.